Welcome back. Today we want to talk about heart disease. It is the leading cause of death worldwide and here in the U.S. according to the CDC. And it kills more than 900,000 Americans each year. That is roughly 1 in 3 deaths. The key risk factors include high blood pressure, high cholesterol, smoking, diabetes, and obesity. But there is some good news. Heart disease is largely preventable through a healthy lifestyle.
Joining us now in studio with more on the disease and prevention is Dr. Thomas Schleeter, a cardiologist with the Community Health Network. Thank you for being here.
Thank you for having me.
We want to jump right in. Why is high blood pressure called the silent killer?
It's a great question because it doesn't have a lot of symptoms. That's the hard thing about high blood pressure. Your blood pressure can be very high and not notice anything. So if your blood pressure is over the top number of 130 or a bottom number over 70, that's considered high blood pressure. And that's changed a little bit lately. We like to get that number actually down to 120 and under 70 as well. So silent, meaning not a lot of symptoms with it. So want to be cautious and careful. And that's why we have a relationship with healthcare professionals.
For sure. We talked a little bit about the risk factors, but really who is at risk when you're kind of taking stock of yourself? What should I be concerned about?
Well, you named them all, right? You named high blood pressure and diabetes and being overweight and sedentary activity and things like that. It's in our genes as well. So everybody wants to be concerned about heart disease. It's the #1 leading cause of death in this country. So we all want to be cautious and we want to be able to modify the things that you mentioned we can modify. Taking good care of ourselves, exercising, eating right, and those things done with a healthcare professional and done in the community as well, done with our loved ones, right? It's a team kind of idea. If we do this alone, we're apt to fail. If we do this together, we'll be better.
And I know it depends on the specific diagnosis, but it sounds like some of this stuff can be reversed. Like if you get high blood pressure or high cholesterol, there are some lifestyle modifications you can kind of work on to change that diagnosis.
You're absolutely right. There are a lot of things we can do to prevent disease and reverse the disease. And that's why it's so important to have a healthcare professional involved with what you're doing. You talked about blood pressure and certainly diabetes and hypertension and high cholesterol. All have things can be done to make those things better and the impact on your life not near severe in the long run.
So it sounds like at the very baseline, you want to know what is going on in my own body. And there's an important way you can do it through this $49 heart scan that we hear a lot about. What is it? How does it work?
Yeah, great question. So the idea is that the leading cause of death in this country is narrowed arteries of the heart. And so a heart scan is one of those tests that's non-invasive that looks at the heart arteries. It looks at the amount of calcium. And we're not talking about drinking milk or anything like that. Calcium is related to blockage. The more calcium we pick up on this scan, the more blockage we're worried about. And we're picking that up when we're asymptomatic, when we're not having problems, so we can address those issues like you were talking about earlier to reverse and prevent further heart damage or any heart problems moving forward.
Jenny, you were just talking about this scan.
Yeah, I actually, my husband and I both got a scan a couple of years ago. I saw the commercial. I saw what was on Channel 13. I said we should do it. I was shocked at how fast and how easy this was. We were in and out within minutes.
Say that again.
In and out within minutes.
Yeah, it's a really easy thing to do. It is very beneficial to know exactly what's going on and being able then to take the steps saying, hey, listen, you had a good heart scan. I'm not trying to divulge anything you said. So you're taking the steps to make sure it stays that way. If it wasn't, you'd be more aggressive in taking steps to make sure it doesn't get worse.
In the case where knowledge is power.
Yeah, for sure.
Well said.
Yeah. All right. Thanks so much, Dr.
Thanks
Schleeter,
for having
joining
me.
us. We certainly appreciate it.
Thank you.